Hello, Aurora team. This safety talk focuses on emergency preparedness. During this training, we will discuss various emergencies and effective response strategies. This safety talk will cover 1. Introduction of night and weekend shift supervisors. 2. Explain calling 911 procedure. Situations on when to call 911 and what to say during a 911 call. 3. Explain fire and fire alarm procedures. What to do in case of a fire. How to use the fire alarms. Evacuation procedure and muster stations. Use of fire extinguishers and evacuation kits. 4. Explain power loss reporting procedure. 5. Explain flooding procedure. 6. Explain the safety equipment in place at Aurora. To ensure safety supervision across all shifts, 2 employees from ISM Printing have been appointed as night shift supervisors. Sean Boyle will oversee the front half shift from Sunday to Tuesday and every other Saturday 7 p.m. to 7 a.m. Ian Cunningham will oversee the back half shift from Wednesday to Friday and every other Saturday 7 p.m. to 7 a.m. Additionally, Tom March from the pre-press area serves as the backup health and safety contact, covering Friday to Sunday 7 p.m. to 7 a.m., but Tom also conducts monthly inspections and provides assistance during health and safety issues. He has extensive experience as an off-shift safety contact at Aurora. These supervisors are trained in health and safety responsibilities and should be contacted for any health and safety or production-related issues. Calling 911 procedure. In the event of the following emergencies, it may be necessary to dial 911. Authorized supervisors or designated first aiders are responsible for making this call. If they are not present or unable to do so, any employee may initiate the 911 call. It is important to designate only one person to place the call to 911 to prevent any confusion or delays in response. The emergencies listed are chest pain or tightness, shortness of breath or difficulty breathing or choking, sudden severe pain, severe blood loss, sudden dizziness, vision problems or losing consciousness, sudden weakness, numbness and or tingling in the face, arm or leg, sudden difficulty speaking, opioid poisoning. Other emergencies such as uncontained or uncontrolled fires, robbery, burglary, vandalism, suspicious activities like suspicious packages, unidentified substances, or potential terrorist threats to employees' safety. Critical injury. A critical injury is defined as an injury of a serious nature that places life in jeopardy, produces unconsciousness, results in substantial loss of blood, involves the fracture of a leg or arm but not a finger or toe, involves the amputation of a leg, arm, hand, or foot, but not a finger or toe, consists of burns to a major portion of the body, causes the loss of sight in an eye, workplace violence that involves criminal behaviors or poses a threat to others' safety. The list of trained first aiders is posted on the communication boards. Please make sure to familiarize yourself with it. If you have any emergency, call 911 immediately. During the 911 call, answer the following questions to get help. A 911 call taker will ask, 911 police, fire, or ambulance for a medical emergency, say ambulance. Your call will be transferred to ambulance dispatch. Do not hang up. A 911 ambulance call taker will ask questions to get you help. If you need a translator, say the language you speak. Your call will be transferred to a translator. Do not hang up. 911 ambulance call takers ask questions to understand the emergency and your location. What is the medical emergency? What is the address of the emergency? Say 275 Wellington Street East, Aurora, Ontario. Intersection, Wellington Street East and Industrial Parkway. Make sure to tell them clearly about the entrance. Entrance to the building, please ensure that EMS is informed of the 2 specific entrances they can use. Based on the emergency location, they have the option to enter from the front of the building, door 5 near cafeteria, or back of the building, door 20 near receiving. Do not hang up without confirmation. Have someone waiting by the outside door. Once EMS arrives, take them to the incident area quickly. If you see a fire or explosion, immediately stop the work that you are doing. Shut down your equipment as needed. Activate the nearest fire alarm pull station. Alert and/or notify your supervisor and others of the emergency. Advise your supervisor of the exact location of the fire or explosion. Leave your area immediately via the nearest safe exit. Assemble outside the building in the evacuation assembly area and report to your supervisor. Do not leave your designated area until you hear all clear from your supervisor. Do not re-enter the building until it is officially safe to do so by order of the emergency coordinator. Do not smoke, use cell phones, or enter or start vehicles. If the fire is small and you are authorized, trained, familiar with the use of a fire extinguisher, then you can attempt to control or extinguish the fire. Our plant has ABC-type fire extinguishers installed throughout the facility. These units can be used on wood, paper, cloth, trash, flammable liquids, and energized electrical equipment. Fire extinguishers are inspected every month. Fire exits must be clear at all times.
Fire extinguishers are one of those things that workers are convinced they know how to use for the simple reason that they're always around. Such is the case for our friend Aiden here, who has no idea that he's got no idea how to use one. Let's put his theory of innate learning to the test by using our crash test dummy Larry as a stand-in. What'll happen to Larry if he forgets to remove the pin? That's gotta hurt. What'll happen to Larry if he comes into contact with the product discharged by the extinguisher? That'll need fixing. What'll happen to Larry if he tries to put out a fire that exceeds the fire extinguisher's capacity? Larry? Okay then, Aiden, you're up. Unless I first take a moment to explain how to use a fire extinguisher. It goes without saying that your employer must select the proper fire extinguishers before a fire occurs. Make sure you have an appropriate fire extinguisher at your disposal. The first thing to do is to pull the fire alarm and begin evacuation, because if you can't extinguish the fire, you will have lost valuable time. For a fire to be extinguished by an extinguisher, it must occupy a small space, and the height of the flames must not exceed your own height. If these two conditions aren't met, don't even think about it. Always stand between the emergency exit and the fire so that you're not trapped if the fire grows. Maintain the proper distance, namely about 2 to 3 meters. Pull the pin. Hold onto the carrying handle with one hand and the discharge hose or horn with the other. Caution: if your extinguisher contains carbon dioxide, also known as CO2, the nozzle can get very cold. Aim at the base of the fire. Squeeze the handle to release the extinguishing agent, and release it to stop the discharge. Sweep from side to side with the hose. If the fire starts to diminish, move closer. If it increases, move back. Never turn your back on a fire. At any time, if the smoke gets too thick, or if you can't extinguish the fire, leave immediately. When you use a fire extinguisher to extinguish a fire, you must empty it completely. Recharge or replace your extinguisher as soon as possible after each use. Even though you now know how to use a fire extinguisher, you're still nowhere near being a firefighter. So be careful.
If you hear fire alarm, initiate emergency shutdown procedure. Leave your area immediately to the nearest safe exit. Assemble outside the building in the evacuation assembly area and report to your supervisor. Do not leave your designated area until you hear all clear from your supervisor. Do not re-enter the building until it is officially safe to do so by order of the emergency coordinator. Emergency evacuation kits intended for use by fire wardens during emergencies are strategically located at doors 1, 4, 8, 19, 24, and 25. These kits are accessible to any employee heading to muster areas in the event of emergencies such as fires or fire alarms. Employees are encouraged to retrieve a kit and deliver it to the fire wardens. Each emergency evacuation kit includes the following items: 2 reflective traffic vests, flashlight with batteries, 50 disposable blankets, 1 walkie-talkie set to channel 7, list of full-time regular employees, 1 clipboard, 2 pens, and 1 pad of paper, emergency phone list and evacuation map. As indicated in this slide, TC Aurora has 6 designated muster areas where employees must report. These muster areas are designated according to departments, and it's essential for employees to report to their assigned muster areas. For further information about your designated muster station, please proceed to the next slide. FYI, due to changes in the parking structure, the red muster area has been relocated closer to the green muster area. Please refer to the slide for more details. During 7 a.m. to 7 p.m., employees must report to their designated muster stations. The following departments report to Muster Area White: ISM Customer Service First Floor, Studio, Information Technology, Human Resources, Scheduling and Planning, Specialty Finishing Mailer including Bobst Folder Gluer and Purchasing. Location Front Parking Lot Carpool Spots West. The following departments report to Muster Area: Yellow, Production Management, Print and DM Customer Service, Sales, Senior Management, Cafeteria Personnel, Second Floor Executive, Office Area, ISM Group Second Floor, Newkirk Account Managers. Location Front Visitor Parking Lot North. The following departments report to Muster Area: Blue, Bindery Cutting, Folding, Shrink Wrap, Stitching, Tippers, ISM Large Format Printing, ISM Cutting, ISM Lamination, ISM Die Cut, Bob's Die Cut Presses. Location Front Parking Lot West. The following departments report to Muster Area: Red, Creative and Pre-Press, Intercompany Sales, Finance, Estimating, Call Center, Third Floor Kitting, Data, Newkirk Customer Service PMS. Location outside SFDT 400 Area East. The following departments report to Muster Area: Green, Letter Shop and Letter Shop Handwork, SFD or T400 Area. Location outside Maintenance Area East. The following departments report to Muster Area: The Black, Sheet Fed, Samples, Inventory, Receiving, Shipping, ISM Hand Finishing, ISM Kitting Fulfillment First Floor, ISM Production Management, Maintenance. Location Receiving Back Parking Lot East. Keep in mind that this reporting structure is applicable to all employees from 7 a.m. to 7 p.m. Due to limited employees and fire wardens during night shift, any employees who were previously reporting to 1. White, yellow, or blue muster areas will now report to white muster area only. 2. Red, green, or black muster areas will now report to black muster area only. In case of power outage, stay calm, assess the conditions. Turn off the machines, if possible, to prevent overload when power returns. Emergency lights will turn on during power outage. Use emergency lighting or your own flashlight to navigate safely through darkened areas. Pay attention to the path, be careful of trip hazards. If you can do so safely, assist coworkers with disabilities. Report to the cafeteria. Stay at the cafeteria. TC Aurora Senior Management will monitor the situation and advise whether employees are to be sent home, so wait for further instructions. In case of expected flooding, for example, severe weather, turn off all the equipment. Follow instructions to evacuate or move to upper levels of the building. If internal flooding occurs, for example, burst pipe, immediately turn off affected equipment. Contact your supervisor to assess emergency shutdown options. Cover equipment where feasible and safe to prevent water damage. Remove all non-essential personnel from the area. Lockout procedure before inspection. Ensure equipment is locked out to prevent accidental activation during inspection, post-flooding inspection, and drying process. Maintenance must conduct a thorough inspection of all equipment. Ensure equipment is completely dried by maintenance before attempting any restart procedures. Suspect equipment water damage. Do not attempt to activate. Report concerns to a supervisor or manager. TC Aurora has installed green safety boards across various departments to ensure employees have access to health and safety equipment during emergencies. These boards are equipped with various safety gear and are located in the following areas: Bindery, outside LFD room, sheet fed or litho room, kitting first floor, letter shop outside T400, kitting third floor, main hallway office. All 6 of the green boards installed in the plant have the same safety equipment installed, including AED. Automated external defibrillator is a portable device that delivers an electric shock to the heart during cardiac emergencies to restore normal rhythm. Our first aiders are trained on the use of AEDs. Naloxone kit. The naloxone kit contains medication used to rapidly reverse opioid overdose. Our naloxone kits include a nasal spray form of naloxone, along with instructions for administration. TC Aurora has trained personnel on the use of naloxone. This kit is placed inside the AED cabinet. First aid kit. The first aid kit contains all the necessary supplies for first aid, such as bandages, gauzes, antiseptic wipes, scissors, and adhesive tape. Eye wash station. In case of a chemical splash in the eyes or face, eye wash stations are available for use. Certified first aiders and nearest hospital or clinic's info. This document includes information on the nearest hospital or clinic addresses, their operating hours, phone numbers, and directions to reach these facilities. Additionally, a list of certified first aiders, including their names, departments, shift times, and certificate expiry dates, is also posted in this section. Earplug dispenser. The only difference with the office-installed green board is that it contains an oxygen tank instead of an eye wash station. The oxygen tank is intended for use in emergencies, such as instances where employees experience difficulty breathing or in cases of opioid poisoning. All other items remain the same as those on the plant green boards. The oxygen tanks are located in the following areas: main hallway green board, second floor office near bathrooms, first aid room, outside litho room and trauma kit. All of our first aiders are trained in the use of oxygen tanks. To enhance response times during critical injuries, a trauma kit has been introduced. This kit is positioned outside the litho sheet room and includes the following items: first aid kit, AED, automated external defibrillator, oxygen tank, blanket and pillow. First aiders can retrieve the kit and proceed to the incident area to administer first aid. TC Aurora also has a designated first aid room. This room is located in the receiving area and has following items available in it: stretcher, wheelchair, gurney, eye wash station, AED, naloxone kit, first aid supplies. Return to work kit. Return to work kit is given to the employees when they require medical treatment as a result of workplace injury. This kit contains following items: hospital kit instruction sheet, corporate RTW brochure vigilance, local medical facilities information, WSIB Form 6 employee, WSIBFF functional abilities form, transcontinental accident investigation form, taxi chits X2. Injured employees must take this kit from their supervisor before seeking medical care and ensure that a medical professional completes the functional abilities form, FAAF. Once completed, the FIAF should be provided to their supervisor or manager. TC Aurora operates an early and safe return to work program to accommodate injured employees, facilitating their recovery from injuries. As we wrap up, your safety is our top priority. Stay vigilant and proactive during emergencies. Keeping informed about safety initiatives and resources is key to preparation. Thank you for your dedication to safety. Stay safe.